I'm Dr. Bryan Kelly. I'm the chief of the sports medicine service at the Hospital for Special Surgery, and today we're going to be talking about arthroscopic treatment of femoral acetabular impingement in the hip. Chapter 7, Capsule Repair. Once the femoroplasty is completed, a dynamic assessment confirms the absence of any residual bony impingement on the femoral side. At the completion of the resection, repair of the capsule is essential to restore normal mechanics of the hip joint. Typically, 3 or 4 sutures will be placed across the T-cut using strong number 2 non-absorbable suture material. Once the T-cut is completed, then 2 to 3 sutures are placed across the interportal cut to restore the interportal anatomy as well. If the T-cut and the interportal cut are made effectively at the beginning, good restoration of capsular anatomy can be achieved. Here we see the preoperative X-ray demonstrating the cam impingement morphology off of the anterior head-neck junction. We now see a 6-week post-op X-ray, which shows good restoration of the offset and restoration of the sphericity of the femoral head, which will allow for good impingement-free motion across the hip joint.